So, this 2 weeks, 2.5 weeks, week and a half, we're going to hit trauma pretty hard and heavy. All right, this is the overview.
Is that all we have left?
Trauma and OB.
Because
Yeah.
trauma gets hit.
Let's see. The computer's running slow today. We're going to talk about the kinetics of trauma, mechanism of injury, multi-system trauma patient, the gold period, platinum 10 minutes, actual trauma system, and the golden principles of pre-hospital trauma care. All right. Nina and Scotty respond to the report of a person shot in a hunting accident. After a 15-minute response to the remote area, they meet state police at the scene. Police confirmed that it was a hunting accident and all weapons have been secured. Patient's a 27-year-old man was accidentally shot by another hunter with a high-velocity rifle. As they do their scene size up, they see a police officer holding direct pressure on the patient's thigh. The patient is lying supine on the ground, seems combative and confused. He is pale and sweaty despite the cool temperatures. Alright, so what's going to be your priorities in managing this patient? Okay. Why do y'all think he's kind of combative and stuff? Blood loss, one shot. Okay. What information is going to help you determine the extent of their injuries? Okay. Amount of blood, your assessment. Alright, we're going to learn how to make special considerations in sizing up a mechanism of injury when it comes to trauma. Alright, to make these judgments, you must not only recognize obvious injuries, but also maintain a high index of suspicion for hidden injuries. Alright, we can't always see on the inside. An understanding of mechanism of injury is the chief component that is crucial for your trauma assessment skills. How severely a person is injured depends on the force with which he or she collides with something or something collides with them. This force depends partly on the energy contained in the moving body or bodies. The energy contained in a moving body is called kinetic energy. Kinetic energy in a moving body is calculated as the mass, which is the weight in pounds, times the velocity, speed in feet per second, squared, divided by 2. This is not something we really have to know, okay? What the formula illustrates is that the mass of a moving object is doubled. Its kinetic energy is also doubled. You would be injured twice as badly as if you were hit by a 2-pound rock as you would if you were hit by a 1-pound rock thrown at the same speed. I think most of us kind of already figured that out. Alright, velocity is a much more significant factor than the mass. Suppose you were hit by a rock thrown at a velocity of 1 foot per second, and then hit again with the same rock thrown at 2 feet per second. The rock thrown at 2 feet per second would not be twice as harmful as the 1 foot per second, but would be 4 times as harmful because you square it. Okay? So, understanding the factor of velocity is important in evaluating your mechanism of injury, especially in vehicle collisions. During your scene size up, as you try to get an idea for how serious vehicle passengers may have been injured, it is important to estimate the speed of the vehicle or vehicles at the time of collision, knowing that a high velocity collision will most certainly have caused greater injury. Alright. The rate at which a body in motion increases its speed is known as acceleration, and the rate at which a body in motion decreases speed is known as deceleration. If one car is braked to a gradual stop and the other is stopped suddenly by striking a telephone pole, the one with the faster rate of deceleration exerts more force. So the one hitting the telephone pole is going to hit harder. Kinetic energy transmitted to a human body continues to travel in a straight line without interruption. Injury will occur. However, energy traveling through the human body is frequently interrupted by the body itself or deflected. By comparing the number of impacts, it's easy to understand why a person in or on a moving vehicle who gets thrown has much more greater chance for injury than one who is restrained or remains in the vehicle. All right, you have three types of collisions. You have a vehicle collision, then you have body collision with the vehicle, then you have organ collision with the body. Okay. Come on. All right. So here's your first collision. The vehicle strikes an object. The occupant continues forward and strikes the inside of the automobile. The patient comes to a quick stop on some part or parts of the inside of the vehicle, such as the steering wheel, causing injury to the chest. This is your second type of collision. And your third type. In the organ collision, the patient's internal organs, which are all suspended in their place or spaces by tissue, come to a quick stop, sometimes striking the inside surface of the body. The inner chest wall or the inner skull is an example of these. Okay. All right, with an understanding of mechanism of injury, or MOI, you will be able to arrive on the scene of a vehicle collision and suspect, simply from looking at the damaged vehicle, which types of traumatic injuries the patient may have. A force severe enough to kill one passenger will almost certainly cause severe injuries, if not death, to all other passengers in the same compartment. Okay? One of the earliest signs of brain injury is altered mental status or unresponsiveness. Consider the patient's mental status prior to your arrival when determining a baseline mental status, especially in the patient with a suspected head injury. All right, intrusion of the vehicle is a deformity occurring into the interior compartment. The occupant site is anywhere in the vehicle where the patient was riding. A patient who has been partially or completely ejected from a motor vehicle is at much greater risk of injury than one who has remained inside the vehicle. Studies have shown that mechanical aspects of vehicle collision can predict injury in motor vehicle crashes. Data from telemetry systems such as seatbelt use, direction of impact, and changes in velocity provide the most important predictors of severity of injury. All right, you're not going to be able to access those data terminals. All right, so what kind of impacts do we have?
Vehicle, body, or what?
Yeah, that's
Oh, okay, organs.
yeah. What kind of impacts do we have on vehicles?
The injury.
Okay, so that'd be what, front, side,
Oh,
T-bone.
yeah. Okay, accident.
Right here?
Yep.
Okay.
You have front impact, rear impact, T-bone, which is lateral, can happen on either side, and then you have rollovers, which is rotational. If all else fails, read
Isn't
the
that
board.
shit you sent me? Like, when you don't want to tell them they're fucking stupid. No, she sent me so damn mean.
No, she sent it to me too.
Oh.
It was
Like,
at
whatever,
work
you
and
know
I just
they're
started,
trying,
like,
but
busting
damn
out
it, you know
laughing.
what, I can feel stupid.
And they were like, what are you laughing at? I was like, my teacher sent me something.
Nothing. In the frontal impact, the driver continues to move forward at the same speed the vehicle is traveling, okay? So if you're going 60 miles an hour in your vehicle, you're going 60 miles an hour. Your body is going 60 miles an hour. Your organs are going 60 miles an hour. If that vehicle stops, you are going to come to a sudden and complete stop. So are your organs. All right? When you're traveling forward and you come to a complete stop, you proceed to go either up and over the steering wheel, causing injuries to the head, chest, neck, abdomen, and possible ejection through the windshield, or you go down and under the steering wheel, causing injuries to the knees, femurs, hips, pelvis, and spine. Come on, computer. Okay. Alright, so vehicle's moving at 60 miles an hour, your patient was moving at 60 miles an hour, and your organs were moving at 60 miles an hour. If an unrestrained occupant of a vehicle involved in a collision travel in an up and over direction, they may be ejected from the vehicle. Frontal impacts. You will see damage to the abdomen. A damaged dashboard or steering wheel should cause you to suspect abdominal injury. As the abdomen strikes the dashboard or steering wheel, the liver, spleen, and hollow organs of the abdomen are compressed between the front and back abdominal walls and spine. The hollow organs are more easily displaced, leaving the solid liver and spleen to bear the brunt of the compression. That's why you always hear about spleen lax, liver lax, okay? They're more easily injured. All right, as the chest hits the dashboard or the steering wheel, bones and soft tissue are both affected. The ribs and sternum can break, and the cartilage containing the ribs in the sternum can separate. A torn intercostal artery can bleed 50 milliliters per minute into the chest cavity with no blood seen externally. The heart and lungs are the major organs affected. The heart suffers the effect of two forces, compression and shear. Compression force occurs when the heart is caught between the sternum and the spine, which can bruise the heart muscle. The heart is suspended by the aorta, which is attached posteriorly by the arch, usually by a ligament. Okay? Shear force tends to pull the aorta at the ligament, which can tear or transect the aorta. The lungs can also be affected. Air trapped in the lungs by sudden closure of the epiglottis is compressed between the ribs and spine. This kind of compression injury is called paper bag syndrome, because it's like blowing up a paper bag, then popping it between your hands. All right, head, face, and neck. The face, head, and neck are the next impact the deployed airbag, dashboard, windshield, or window, depending on whether there is more than one impact. As you approach the vehicle, check for typical starburst windshield cracking. Depending on the impact point, the face may have extensive soft tissue damage. Head injuries usually result when the occupant is ejected from the vehicle, and the skull fractures can occur. Depending on the force involved, penetrating bone shards or a depressed skull fracture can result and lacerate brain tissue. All right, there's your up and over points of impact. This is what a deformed steering wheel looks like. Okay. Bent. Literally bent. Patients in a frontal collision who are unrestrained can come into contact with the steering wheel or dashboard as their airbags deploy. The explosive force of the airbags can produce chest trauma, chest injury. Okay. This is a little diagram of the paper bag. What do most people do when they see something coming? They tense up. They take a big deep breath and brace for impact. Okay? When you do that and you impact, your epiglottis closes and you have all that air in your lungs. That chest comes forward, hits the steering wheel, and your lungs can pop. Okay? This is why drunks don't ever get hurt. They don't brace. They just go with the flow. Okay? Alright, frontal impact. The driver goes down and under the steering wheel, is subject to injuries to the knees, femur, hip, pelvis, and spine. Alright, there's all your impact points. Knees, femur, pelvis, spine. Don't forget your feet and stuff can get caught up in those pedals underneath there. Even in the absence of bone injury, the force of impact can damage the brain. First, the floor of the skull is rough with many sharp projections. When the brain moves across these projections, it can become lacerated or bruised. Secondly, the brain can rebound against the opposite side of the skull from the original point of impact. This is called coup and counter coup. I didn't come up with these terms, I don't know. The body is propelled forward by the seat, while the head and neck tend to remain at rest, following the law of inertia. Because the weight of the body exceeds that of the head, the body keeps moving while the head slows down. This is why you get so many neck injuries with rear impact collisions. You get the whiplash and such. That is a medical term.
Is it?
Whiplash. It's whiplash, but yeah, I call it whiplash. Cause you know, we're like country, and people never say I'm gonna whip you. It's I'm gonna whoop you. Yeah, so I always call it whiplash. All right, rear impact. Yeah. Hope they were sitting in the front seat. An improperly positioned headrest that is pushed all the way down to restrain just the neck and not the head can contribute to the severity of injury by creating a fulcrum against which the neck will bend backwards.
I don't feel like no position their headrest was in would have protected any part of their body.
Yeah, if it was up where it was supposed to be. it
In that
would-
kind of car crash?
Yeah. If there's a headrest that has been properly positioned and seatbelts are worn, injury is minimized. However, if the vehicle does not have headrest or they are improperly positioned, the neck is hyperextended and the anterior spinal ligaments are often stretched or torn. This is where whiplash comes in. All right, lateral impacts. The head and neck, as the energy of the impact is absorbed, the body is pushed laterally to the side, out from under the head. This causes the head to move in the opposite direction. This can also cause neck injuries. Chest and abdomen. Injuries occur when the door strikes the side of the chest and abdomen. If the impact on the shoulders, the energy traveling through a straight line may dissipate at the curve of the clavicle, resulting in a fracture. If the arm is caught between the door and the chest, or if the door hits the chest, fractured ribs and flail segments are possible. Pelvis. The impact of the vehicle door to the chest wall also causes a lateral impact to the pelvis. Fractures of the pelvis and upper femur usually complete this pattern. Why is my computer running so slow today? Maybe because I didn't use it yesterday? Alright, when a vehicle is struck laterally or directly on its side, it can be crushed inward, trapping the occupants. Alright. Injuries can occur to the head, neck, chest, abdomen, pelvis, and extremities. You need to ask yourself who took the brunt of force from that collision and carefully examine the side of the patient's body that bore the brunt of that lateral impact. Okay? And don't forget the other side either. Alright? The rotational or rollovers. The vehicle spins around the point of impact, causing the occupants who are not restrained to strike the mirror, posts, doors, resulting in many injuries. Both head-on and lateral injury patterns occur. The vehicle hits the ground multiple times and in various places. The occupants change direction every time the vehicle does. Although a specific pattern of injury is impossible to predict in a rollover, there are a few common characteristics. First is multiple system injury. Second, ejection is common if the occupant was not restrained. And crush injuries to ejected occupants are common, okay? When that body gets thrown out of the vehicle, it's thrown in the direction that the vehicle is traveling, okay? So if you get thrown out, you're going to be pretty lucky if that car does not land on you at some point, okay? All right. This is a rotational, looks like end over end. Alright, there's one. It's still upside down. Not a whole lot of damage looks like to that, maybe to the front. Oh, let's go back to this. Vehicles with a high center of gravity, such as SUVs, vans, and what else has a high center of gravity that will be operating
Ambulance.
are more prone to roll over. Okay? Following the laws of motion, if you go straight through the windshield into the ditch, so does your vehicle, right into the ditch, on top of you. Sometimes patients are thrown into other lanes of traffic too fast for oncoming vehicles to avoid. Could you imagine?
You got ran the fuck over.
Well, I mean, if you ran somebody over,
Oh, yeah.
like, could you imagine if that happened and, like, you didn't have the time to react? Like, that,
Dude,
oh my
like, somebody was
gosh.
trying to commit suicide. Like, he had a son in the car, and he jumped out the interstate in front of him, and fucked him and his son up.
Mm.
Killed him.
Goodness. The patterns of injury are likely to be different in children than adults. This is because adults are larger and have a different weight distribution. Also, children and adults react differently to impending collision. A child who is about to be hit by a vehicle, whether the child is walking or riding a bicycle, generally turns towards the incoming vehicle. So injuries from the impact are generally to the front side of the body. An adult usually turns away. So the most common impact is to the back. Okay. Hidden injuries can occur from the use of restraints in motor vehicles, including airbags, seat belts. Lap belts, when worn properly, distribute force across the iliac crest of the pelvis. The lap belt prevents the occupants from being ejected, but without a shoulder strap, it does not prevent the chest from striking the steering wheel or the head and neck on the dashboard or steering wheel. Compression fractures of the lumbar spine occur as the torso is forcibly flexed forward. If the seatbelt is worn too low, it can dislocate the hips. And if that shoulder strap is worn too high, one of the first calls I ran when I was doing my EMT clinicals, we worked a wreck on the interstate on I-55 North, just north of Grenada, Mississippi. The woman had a seatbelt on, but it was across her throat, not her chest. And it was raining real bad, and this family had pulled over on the side of the road, and she ran into the back of them. And all of this was crushed. All it takes is 30 pounds of pressure to crush your trachea. So all of this is crushed.
Who prefers to wear their damn seatbelt like that?
I don't know. I personally put mine under my armpit and across because I'd rather have broke ribs than a crushed trachea. Me, personally. That's just me. I'll do what you want to do, but, you know, me. I'd rather have. Alright, this is a picture of a seatbelt injury. You can see where it came across his belly. There's another one. My computer will come on. There we go. Across the abdomen, looks like she's got some seatbelt rash there. Probably that wouldn't pull it off. To prevent head snapping, the proper position for a car seat is to face backwards and recline to a 45-degree angle. To completely avoid injury from airbag deployment, children should always be restrained in the back seat of a vehicle and not in the front passenger seat.
You ever take their car seat? Like, if they're okay to just take the car seat?
Yep. Show did.
Set it at.
In the captain's chair. You sit on a bench seat, you sit it anywhere. Sit on the stretcher. But yeah, we transport car seats. There's nothing wrong with them. Alright, so, motorcycle collisions. Laying the bike down is an evasive action on the part of a rider designed to prevent ejection and separation of the driver of the bike from an impending collision. The bike is turned sideways and laid down with the driver's inside leg dragging the pavement or ground. The driver tends to lose speed faster than the bike, thus moving the bike out from under the driver. Abrasions can range from superficial, involving only the epidermis, to full thickness, which extends through the subcutaneous tissue, and in severe cases to the covering of the bone. Abrasions can be complicated by particles embedded in the tissue, such as grass, dirt, or asphalt. Blech. This is considered an ejection, okay? There's the vehicle. There's the motorcycle. Not real sure where the rider is. I hope
There's
he's all
his
right.
shoe.
Yeah, well, we hope that was his shoe. We hope he had some long sleeves and long pants on. You see those people, like in Jackson, it's on Sundays. You see them on these crotch rockets. Not even nothing down the damn interstate.
Them little
120.
wheelie things.
Yeah, and they have on white beater t-shirts and flip-flops and shorts. And I'm like, dude, one little bad wheelie and it's gonna be
And I'm
all
gonna
she
get pissed
wrote.
off because y'all are gonna fall over here. Then I'm gonna run over you, like you said. Then I'm gonna be fucked up because I ran over your stupid
Exactly.
ass. You want to pop a little cute little wheelie.
Exactly. But, Alright, it's soft tissue injury to the face. Boots, leather clothing, and a helmet help protect against soft tissue damage, commonly known as road rash. I think Louisiana is a helmet law state, right? You have to have a helmet on.
Even on scooters.
Yeah.
You do too on scooters.
I said even on scooters.
Yeah.
I got a ticket.
I don't.
Me too.
She got offensive, so you do too.
I know, 'cause I got killed.
I got killed when I was 15 for driving a little 150cc moped, not wearing a helmet.
Alright, ATVs are unstable and easily tipped and are very similar to motorcycle collisions, except usually it will fall on you and stay on you. Alright, falls. There's lots of different things we need to consider when we think about falls. Internal organ damage is frequent and you should have a high index of suspicion regardless of how the patient looks initially. The pattern of trauma injuries also depends on the part of the body that impacted first. Alright? We need to know how far they fell. Were they standing on the first step or the 20th step going into a house? Alright? What surface did they land on? Did they land on a pillow or did they land on concrete? Did they land on water? Alright? A body of water, not just a puddle. And we need to know what body impacted the ground first. Okay? Anything greater than 20 feet in an adult is a trauma activation. It is considered a high index of suspicion. Anything greater than 10 feet or 2 to 3 times the height of a kid. Alright, a feet first landing causes energy to travel up the skeletal system. Fractures of the heels and fractures or dislocations of the ankles are common. If the knees are flexed at the time of impact, most energy is dissipated at the knees and preserves the rest of the skeletal system. However, if the person lands flat-footed with the knees locked, ooh, it just sounds painful, energy is transmitted up through the femurs to the hips and pelvis, possibly causing fractures. Alright? Not only does it go to the hips and the pelvis, it goes all the way up your spine. If fall is more than greater than 20 feet, the internal organs are likely to be injured from deceleration forces. These are your liver, spleen, kidneys, aorta, and heart can be affected. A feet first landing causes energy to travel up the skeletal system. Fractures of the heels and dislocation and fractures of the ankles are common. You can also have fractured vertebrae, pelvis, femurs. In a head first fall, the injury pattern begins with the arms and extends to the shoulders. The head can be forcibly hyperextended, hyperflexed, or compressed, all of which can cause extensive damage to the cervical spine. Alright, it's human nature. If you feel like you're going to fall, you put your hands out. Alright, this can cause injuries to fingers, wrists, radius, ulna, humerus, elbows. What are you doing? Never mind, I don't even want to know. Penetrating injuries are caused by any object that can penetrate the surface of the body, such as a bullet, dart, nails, or knives. The amount of damage that results depends on the amount of kinetic energy transferred to the tissue and the area of the body it penetrates. So if I come at you with a small little No,
Knife.
what's those, what kind of knife? No, not a box cutter.
Kitchen knife.
We'll go with box cutter. Alright. If I come at you with a box cutter, or if I come at you with a big old chef's knife, which one's going to create more damage?
That's chef's knife.
Chef's knife. Okay.
I heard me failing in the darkness.
Oh, you're going to be first on my list. Alright, the amount of kinetic energy transferred to the tissue is the greatest indicator of potential damage. For example, if the object is a knife, the low kinetic energy limits the damage to just the immediate site of impact in the underlying tissue. The higher kinetic energy of a bullet results in tissue damage extending relatively far from the site of impact. Okay? If the kinetic energy produced by the bullet is totally absorbed by the body tissue, the bullet will not exit. If kinetic energy remains with the bullet, however, an exit wound will occur. What's the most dangerous caliber of bullet? A 22.
The other one that had all the venting?
No, it's the smallest.
That's how it come out.
It's gonna bounce around inside. Yeah. Usually the higher the caliber, the more force usually, and it'll enter and exit. You'd rather have a 3-3 than something just bounce around inside. Creates way, way more damage. A person stabbed from behind in the upper left chest with a short 3-inch paring knife may suffer a pneumothorax, which is air in the chest cavity. If stabbed with an 8-inch knife, injuries can include lacerated pulmonary veins, lacerated aorta, and even a laceration of the heart itself. Alright, kind of just went over that. Shotgun wounds differ significantly from rifle or handgun wounds because shotguns have multiple pellets that spray in a pattern. The multiple pellets increase the impact surface area, thus increasing the amount of energy transferred to the tissue. Close range gunshot wounds can cause devastating tissue damage. Yes, they can. Alright, trajectory is the path or motion of a projectile during its travel. Dissipation of energy, the way the energy is transferred to the human body from the force acting on it. Drag, the factors that slow a bullet down, such as wind resistance, constitute drag. Profile, the impact point of the bullet is its profile. The greater the size of the impact point, the more energy is transferred. And you have cavitation, sometimes called pathway expansion. Cavitation is the cavity in the body tissue formed by a pressure wave resulting from the kinetic energy of the bullet. Who is that? Shane? Cavitation